Good morning, everyone. I can see that we've still got a flurry entering into the room. So just to start with welcomes, I am absolutely delighted in terms of welcoming you in today's Northwest Collaborative Masterclass. I'm Suzanne Douglas, Senior System Lead from the NHS Northwest Leadership Academy. I can see there's quite a few people that have introduced themselves into the chat box, but while I am just doing a little bit of intro, can I ask you, if you've not introduced yourself into the chat box, if you can please do so, because it's a great opportunity to see in terms of who's in the space, old colleagues and new contacts that you can connect into as well. So it'd be really great to kind of just see some of that flurry starting in the chat box as well. Just a couple of things in terms of if you can put your cameras on, it would be great to kind of visually see who's in the space as well. And that would be great for presenters as well to see in terms of who they're interacting with as well. While there are presentations, can I just ask in terms of microphones are switched off, so we've not got any background interference? I'd please encourage you to interact with the chat box as well. So, you know, any insights that you want to share, if you're hearing something and it resonates with you and you've got a really great example that you want to share, or if there's a question that you want to ask to one of the presenters, please use that chat box and we'll be monitoring and interacting with the chat box as well as we go along. So that would be absolutely great. Christina, can I just ask you to move this? Thank you. So as I started the session, the welcome was on behalf of the Northwest Collaborative. So I suppose just to bring some of that to life, as I kind of said, I represent the Northwest Leadership Academy, but the collaborative masterclasses are an offering that are across all 5 partners, which you can see they're all there. And all 5 partners, we actively come together in terms of sharing our expertise and really using that expertise in terms of across our systems as well to enable our stakeholders to think very differently and create some of these spaces as well where we've got a really diverse systems audience as well, where you can all be learning in terms of cross sectors, etc., and across different areas of specialisms and expertise as well. So it's a big thank you behind the scenes as well to the collaborative that have made today what it will be in terms of the agenda that you can see in front of you. So today's masterclass for the next few hours. So buckle up for this. It's going to be a really exciting Oh, can I just ask in terms of just any microphones are switched off in the background, if that's okay? So next couple of hours, we've got a great agenda that's framed around AI, but AI in terms of the context of workforce and actually what that means through a variety of different lenses in terms of actually what do you need to be thinking about in regard to the governance, the risks, the challenges, the opportunities, but also to give you some real practical examples as well. So we've got Sherpa that's joining us from the National AI team to kind of cover that governance bit and a bit of scene setting and a bit of the terminology around AI to really help to create some of that context. And then we've got 2 great case studies that will give real practical reality and really bring to life in terms of challenges, opportunities, etc., and give you some takeaways to think about as well. Those 2 case studies being from Vicky and Leon. And then we've also got the practicalities in terms of actually how do you manage this change? What does good look like within that? And what are some of the things that you need to think about with that as well? So Joe's joining us from HPCA. We'll have a bit of a panel exploration at the end, which will be quite tight-packed. And with the panel exploration and discussion, it'd be great to come to you as an audience for live questions as well. Any questions that you do drop into the chat box, the presenters will be responding to those once they finish delivering their content as well. So we really want this to be an interactive session to make sure that you get some great practical takeaways to support you around this agenda as well. And then I'll just summarise and close the session at the end as well. Most importantly, though, it would be great in terms of if you can hear the voices of our presenters before we get into delivering some of the content. So I'm going to come to Sherpy so you can see and hear her in terms of introducing herself quite briefly into the space.
Thanks, Suzanne. Hi, everyone. My name is Surabhi Gupta. So I lead the regulatory team within NHS England. So that means my team manages all the software and AI medical devices in the portfolio. So things like 111 Online, for example, is a software medical device that we manage as the legal manufacturer. I also act as an advisor to the National AI team. So this is a mixed team between Department of Health and NHS England, and doing a lot of work around AI adoption across the NHS. And I act as an advisor to them. Before coming to NHS England, I was in startups. I've taken a number of software and medical devices through market approval, market access, and as a background, I'm a trained scientist. So I have like a PhD background and worked with Cancer Search UK funded research groups for a long, long time. That's me. Thanks, Suzanne.
Serpy, that's so helpful. And Serpy's happy to answer any questions in the chat box as well once she's presented. So really make the opportunity in terms of tapping into that expertise as well. Thank you. Going to come to Vicky next in terms of quick introduction into the space.
Yeah, hi, sorry, I'm Vicky Furphy, so I'm the CCIO for Community and Mental Health at Alder Hey. I'm also the Deputy Clinical Safety Officer there as well, and I'm a speech and language therapist by professional background as well.
Thank you, Vicky. Perfect. And again, Vicky's happy to respond to any questions in the chat box as well. Joe, we've got you there on screen. Can I come to you next then?
Yes, good morning, everybody. It's fantastic to be here and lovely to meet everybody. I'm Jo Stanford. I head up the Healthcare Project and Change Association. We're a not-for-profit community interest company supporting the development of project and change capability across the health and care sector. And I'm a project and change professional by background and a fellow of the Association for Project Management, and I worked in healthcare for going on for far too long now, but about 25 years.
Thank you, Joe. And finally, can I come to Leon in terms of introduction into the space as well, please?
Yeah, thanks, Suzanne. Morning, everyone. I'm Leon Bergman. I'm Director for Innovation and Finance at Wigan Council. Worked in local government for 19 years, alongside finance, also kind of heavily involved in Wigan's work around AI adoption and transformation as well. Thanks, Suzanne.
Thank you, Liam. Perfect. And you'll get to see our perfectly formed panel, all as a four, again, right at the very end. So in terms of getting straight into the collaborative masterclass then and helping to set some of the context and particularly tapping into some of that advisory space and the governance, I'm going to come straight to Serpy, if that's okay. Perfect. Thank you.
Thanks, Suzanne. So I'm going to try share my screen now. Give me a second. Just a second. So can everyone see my screen?
Perfect. Thanks, Serpy.
Brilliant. So yes, so I'm going to talk a little bit about responsible AI adoption within the NHS. And before going straight into the presentation, I thought I'll just start with a little bit of a background around what is artificial intelligence. I'm not sure how many of the audience have technical background, but sometimes I find for clinical teams especially, they find it a bit difficult to differentiate between a normal software and what is an AI software. So I think it's important to understand that difference here. So artificial intelligence is the name of a broader field, right? So it's about any technology that's data-driven. So the logic of the system is not being defined by humans. Instead, it's being defined by the properties of the data that this system has seen. So what does this mean in practical sense? So if you think about a continuous blood glucose measurement device, for example, which is connected to an insulin pump. So now the Royal College of Physicians would have advised that a normal blood glucose level should always remain between the range of 7 millimolar per liter. So now in a software algorithm sense, you would write an algorithm to say, if the blood glucose level goes over 10, then you inject 1 unit of insulin. That's your normal conventional software. Now with AI, what happens is the algorithm doesn't instruct that you inject 1 unit. The algorithm says, well, you look at the data, the system is now recording historical blood glucose data and insulin, and it knows how you respond, like when you're going for a walk, for example, or what kind of meals you're eating at what times of the day. So it's looking at your personalized levels across the time period. It's collecting that data. And on the basis of that data, it's making a decision that, yes, now if blood glucose is going over 10, then I have to make this decision myself, how much insulin to inject to make sure this levels comes down to 7. So this is the machine that's making that decision rather than human instructing, do this. So that's kind of the basic difference between a normal conventional software and an artificial intelligence kind of a software. There are many, many definitions available for AI across the system. I have picked up a couple of them here, and there are links. We'll share the slides after if you want to read more about how these definitions are coming. But effectively, at the moment, there isn't like a single agreed definition of what AI is. So AI is really referring to a scientific field of study, series of products and services, or features of a product or services. And effectively, it's using digital technology to create systems that are capable of performing tasks which we would have initially thought that they require human intelligence. So that's kind of the broader concept of AI. There are a couple of examples I put here in the box from healthcare settings, some examples that we from the center are involved in. So ambient scribing technologies are quite in vogue at the moment, so quite heavily deployed across the NHS. So these technologies are AI technologies. They're using speech-to-text methods and large language model methods. The Copilot that now we have access to is an AI model. We have a few AI demand forecasting tools, which is again AI. Of course, in diagnostics, AI is quite successful in many areas where it's doing image analysis and predictions. There are things in the wellness space like health coaches, those kind of products. We are thinking about creating an AI-based triage, which might be accessible through the NHS app, for example. And of course, in clinical coding, there has been a lot of good use cases of AI. It's also important to understand what is not AI, because sometimes this is kind of used interchangeably with broad data analytics and computing tasks, which is not really correct. So simple stuff of putting things on cloud-based computing services for data analysis is not AI. Many of the robotic process automation is not AI either, unless it's part of a wider AI-powered system. Using a sensor technology just to record some data from a sensor is not AI. These could be AI-enabled, but just responding to a sensor input with the result usually does not require AI. And some of the smart technologies like voice assistant technologies or IoT, the Internet of Things, those kind of things are also not strictly speaking AI. So then I was asked to just give maybe a few jargon buster examples here. So in this graphic, what I've tried to represent is that artificial intelligence is kind of a broad term, which covers a lot of things, artificial intelligence. So how a machine could mimic human intelligence can be done in a number of different ways. And machine learning is one such way. So machine learning is kind of a subfield within the artificial intelligence field. And deep learning is another subset of machine learning. So what is machine learning? So effectively, where a machine is trained to learn from data without explicitly being programmed to do that particular task. So you're feeding a training data to an algorithm and then asking it to achieve an output without telling it how to achieve the output. So it learns itself. Now, machine learning can be done in various different types. So there can be supervised or unsupervised learning or reinforced learning. So supervised learning is probably one of the most common examples that we see, at least within healthcare, where the machine is given an input data with labeled examples. This is usually called the training set. And once the model is trained on this that training set, then you give it your example, and then it gives an output based on what it has learned from the training set. Unsupervised learning is where there is no labeling provided, no training set provided. The machine itself looks for hidden patterns in the data. In reinforced learning, it's kind of a reward-based system where every time the machine gives an output, it's rewarded for correct answer, and then it learns from that feedback. So with reinforcement learning, the decision-making is getting better and better every time that decision is made. And deep learning really refers to a network of architecture. So it has like several layers, and these different layers are connected with each other. It's quite complex technically, but effectively utilizing machine learning principles, but making them a bit more complex in terms of architecture of the algorithm. And most of the LLMs that we see around, the large language models, are deep learning models. So now with little bit of now understanding of how AI is different from a traditional software, I hope you can appreciate that governance, the way we govern software use within healthcare, needs to be different for AI. And the reason is because of this autonomous nature of the AI system. It's difficult, it's non-deterministic. Every time you give it one input, it's not sure that it will give you the same output. So this non-deterministic nature of AI makes unique challenges towards governance. And therefore, we are having to rethink how do we do governance on AI systems. And because the risks that are arising out of using AI systems are different to normal software systems, and I've listed some of these risks here, and again giving some of the references here. But really, AI systems are heavily dependent on very large and complex data sets, and then governing and assuring those data sets sometimes becomes quite difficult. The training data, so your output depends a lot on where your model has been trained, what training data has been used, and to then understand that this training data should reflect the real world user context sometimes becomes very difficult. So poor data quality and bias will obviously reduce the trust, could potentially reduce the trust, and could potentially cause harm in a healthcare setting. So quite a few challenging differences here with respect to ensuring good governance. Now, from the government, from the center, we've done quite a lot of work around this area, and some good reports and publications have come out. So this model I've picked up from the AI playbook that was published last year. And again, it's saying there isn't really a universally accepted approach to how AI adoption should be done in a responsible manner, but there are certain pillars that we should be looking at when we are thinking of adopting AI within a public sector setting. So of course, safety, security, robustness, accountability, transparency, and explainability are big things in this area. Fairness and bias, contestability, redress, and of course, societal well-being and public good. So these are some of the pillars that have been mentioned in the AI playbook. So from around end of 2024, there have been quite a few milestones that the government has achieved around AI. Of course, September 24, we had the Darzi review of the NHS, and then in December, we had the government plan for change. Then the blueprint for the modern digital government came out, and then the three big shifts were discussed around the government mandate to NHS England, which was followed by the AI Opportunities Action Plan and then the 10-year plan. And of course, now we have published the medium-term planning document as well. And you would see that AI features a lot in these strategy documents for the NHS. So when we talk about the three big shifts, from hospital to community is the first one. Again, there are a number of AI references you can pick in the 10-year plan where how we are aiming to achieve this hospital to community shift. Similarly, for move to analog to digital and from sickness to prevention. So in all these three shifts, we have picked up a number of AI opportunities and commitments, and there are a few shorter term ones within the first 5 years, and there are a few longer term ones. So in the shorter term ones, ABT, rolling out validated ABTs to reduce administrative burden is something I mentioned earlier as well, and this is a big focus at the center at the moment. We're also thinking around creating various different functionalities on the NHS app, some of which would be AI enabled. And in a lot of these AI products that are working in the health space are regulated products. So creating a fit for purpose regulatory framework for AI and medical devices is a very key factor for delivering on these commitments. And then, of course, talking about national procurement for AI as well. So I've now picked up I don't know how I'm doing for time, but I've picked up a couple of key work that is happening in support of this delivery plan at the center. So in terms of ABT tools, earlier last year, we published a guidance to help the system on deploying these ABT technologies in a safe, secure manner. And very recently, we have now produced this registry of suppliers. So these suppliers which have actually passed a couple of criteria, which are mandatory criteria from the center's point of view, they have now been put together in a registry, and hopefully this registry would be helpful to the deployer organizations to make safe decisions. In terms of the new regulatory framework, so currently the regulatory landscape is quite fragmented. We have a number of different regulators playing a role at different part of a product life cycle, from MHRA, CQC, NICE, HRA, ICO, and NHS England as well. So because of this complexity, the developers sometimes find it very difficult to navigate this pathway, and therefore for robust and innovation to happen at scale, some changes in the regulatory framework is definitely warranted. So this is a big piece of work that's happening within MHRA, and DHSA and NHSA are helping support this work. And this was announced late last year. A new commission has been set up to help accelerate NHS use of AI, effectively coming up with a new regulatory framework led by Professor Alistair Denniston from Birmingham, and hopefully we will see the outputs from this commission in the next couple of months. Another really interesting piece of work happening in the regulatory framework side is this regulatory sandbox that MHRA has been running from last 2 years, and in this year's cohort, NHS England has put in one of the products on FDP. So this is now part of the regulatory sandbox where we are trying to develop safe summarization tools. So discharge summary, for example, using AI on FDP, and this is part of the regulatory sandbox. I will now just end with giving a couple more resources for people to refer back to. So this is a product that we run within NHS England. So this is AI and Digital Regulation Service. So it's a knowledge repository of a really good resources coming from the regulators themselves. So this is collaboration between the key regulators in the country, and we curate the content together and update these contents with really interesting blogs and case studies alongside the usual guidance and legislation, etc. So if you're interested in knowing more in this space, I would highly recommend exploring this website. And lastly, I just want to mention the AI Ambassadors Network that we run as part of this national AI team. Really hugely successful meetings, over 9,000 members. We meet once a month online on Teams, and we invite some great speakers to talk about their deployment challenges. So if you're not a member already, I would again highly recommend looking at that. So that's it. I'm not sure how I did for time, but I'll stop here.
Thank you, Serbi. That's absolutely perfect in terms of timing. And thank you very much in terms of creating in terms of the context in actually when we're talking about AI, what is that, what isn't that, particularly in terms of then the governance framework that wraps around that, and some really helpful signposting to resources as well. And also in terms of, I did not know it existed, which is really great to hear, in terms of the ambassador network as well. There are a couple of questions, and there are just a couple of questions in the chat box, if it's okay to respond to those, Sophie, when you get a chance. And I'd please encourage you in terms of if you've got any reflections, etc., and any questions, please do add those into the chat box as well, and make the use in terms of those resources. I have seen in terms of an ask around, a slide will be shared, and also a link to the resources will be shared as well, so you have that all packaged post session as well. So that promptly moves me on in terms of the next segment of the collaborative masterclasses, which is really to bring to life some practical examples. And the first practical example that we're going to bring to you is Vicky, and you would have heard Vicky's lovely introduction at the very start. And Vicky brings a community mental health perspective from Alder Hey. So at that point, I'm going to hand over to Vicky. Thank you.
Yeah, no worries. Okay, I'm just going to share my slides. Hopefully everyone can see those slides. Just wait for a nod. Yeah, brilliant. Okay. So hi everyone. So I'm here to talk about how we've kind of deployed AI within Alder Hey. One of the things that we started was in about July last year, we published our Alder Hey AI strategy. I'll pop the link in the chat after, but there's also a QR code there. I think what we started to realise is, this is a fast moving thing, and we wanted to make sure that we were having the governance structures in place, a lot of things that have just been discussed really, and making sure that they were embedded in the trust. Because I think we've identified, this is something that is only going to get bigger. So we wanted to make sure we were doing it safely as well. And that's definitely part of my kind of clinical safety role, is how can we implement these technologies in a safe manner. So what we decided is to have 4 main pillars to our strategy. So the first is around enhancing children and young people centred care. And this part was really about enhancing and elevating children and young people's experience through the use of AI. So what kind of novel technology can we use to make things easier? Can we use anything to make the experience in the hospital or in the community sites better? And also their overall kind of health journey, and can we empower them as well to take ownership of their own health from a young age? Our children and young people really challenge us on technology, and they want to use the new technology. So we need to kind of keep up with that and ensure that we're engaging with them as well. The next pillar was around empowering Alder Hey colleagues. So this was around freeing up time, but also massively important, supporting wellbeing. I think this for me is just kind of one of those real major benefits of AI for our staff. We can really use this to help with wellbeing for our staff, but we need to do that in a mindful way, and need to ensure that that's considered on every project as well from the beginning. Then we need to transform outcomes for children and young people. So here we were thinking around optimizing pathways and using predictive analytics, and how can they be used kind of within certain care pathways to see if we can help improve the outcomes for patients, but also really using the data that we've got to kind of inform those decisions in care as well. What's working well, what's not working well, can we improve it? And then revolutionizing diagnostics. Now, what I'd say on this one is there's lots of AI technologies around kind of radiography and those kind of things. But when it comes to a pediatric cohort, a lot of companies run away. They just kind of don't, they haven't done it there yet. And it kind of is one of those earlier areas. So we want to engage with the companies and try and support them and obviously use our expertise within Alder Hey, so that hopefully we can develop some of those technologies within the pediatric space. And then kind of centering all of this is the philosophy of AI for good. We want to really ensure that anything we do, we have that mantra in our head. We're only going to use this if this is going to be good for our staff, good for our patients, and good for our families. So that's kind of at the heart of everything that we're doing. Then we've got some kind of key components. So the first one is around education and workforce development. We're using AI in our general lives as well as our professional lives, but I think a lot of people still feel very nervous about it. And actually, we don't want to almost discourage that nervousness, because we do want to make sure that people are aware of kind of the risks of it and the benefits of it, but we want to empower them to make sure that they're feeling like they can use it in their day-to-day job. So we want to equip them with skills and knowledge. So we're doing things like we've got learning events going on. They can do drop-in sessions, kind of just for general kind of really early AI, just to understand what it is, how it's kind of being implemented in the trust. But then we've got kind of more specific masterclasses. So particularly if we're running out AI technology such as AVT, then there's masterclasses focusing on, well, how can you get the best out of that technology and that people can just drop onto and get that knowledge. We also want to kind of create a culture of AI literacy. I think it's one thing to use AI and it's one thing to use AI and know what you're doing. So we want to make sure, and I mean, that kind of links into our digital literacy as well. That's something that we're continuing to work on, and actually that kind of just feeds into that overall literacy level. Then we've got the governance and ethics. So I think straight away we realise that there's going to be challenges here from an ethical perspective around AI, but actually we wanted to make sure we had the governance to feel like we were doing it in the right way, but also supported to make those decisions and also have kind of a trace of all the decisions that we've made within the trust as well. So we wanted to have a governance framework. Obviously, as we discussed some of the regulatory requirements, so particularly I can touch on the AVT ones. When they came into place, we'd already been kind of piloting AVT. So then we wanted to make sure that we were aligning with the new regulations and making sure that we met them with our provider. We want to have a transparency and openness. I think I'll touch later on what our young people have said, but one of the things they're challenging us is they want to know what we're using and why we're using it and how we're using it. So we think we really need to make sure that we're engaging with children and young people and telling them what we're using. Obviously, as a speech and language therapist, I'm then very mindful of we've got to then get that information in a clear manner and make sure that we can understand it at a level that's appropriate for our children and young people as well. And then risk management, obviously including cyber risks that come, but also just the general risks. This is really no different to any other technology. We've still got to follow the normal procedures that we would and make sure that we're kind of delivering it in a safe way. Then AI infrastructure and data architecture. So this was something that we really realised in order for us to use all of this technology, we've got to have that infrastructure. And we're making some improvements around our secure cloud data platform, because we need to kind of bring our data even more modern so that actually we can utilise it more and in different ways. And one of the key elements in the strategy is allowing clinical teams direct access to data. Obviously, we have a lot of information within our EPR, but that can be quite difficult as a clinician. You go in on a patient record level and you're trying to actually work out, okay, is this treatment approach working? And you want to look at that more aggregated data. So we want to empower our clinicians to be able to go in and almost self-serve data in a safe manner, but also be able to kind of get the information they need and actually keep it all in a contained space as well. Because sometimes what you can find is then things go out into PowerPoints and spreadsheets and stuff like that, where actually if we create a platform where they can do that information in the right place, then it's increasing that security, but also increasing their access to the data. Then we've got project development and implementation. So I think for us, it was important that we didn't just go Wild West with AI and just start trying anything and everything. We wanted it all to align with kind of some key themes. So we chose patient outcomes, operational efficiency, and staff wellbeing as kind of our key prioritization when we were considering AIs. And then also finally, really the evaluation of all of these technologies. You need to kind of fail quick with some of these technologies, give them a try, realize they're not for you, they're not going to get that. But the only way you can do that is by evaluating how effective they've been. And your typical kind of doing your baselines pre and post as you go through. So current AI technologies that we have live. So I mean, it's very much flavour of the month at the moment, so I won't go into it in too much detail. But we have our ambient voice technology, which we are using Lyrebird, and we have over 1,000 users of that actively within the trust. We have a range of users, so it's if you ask a speech and language therapist to deploy a product, then I'll tell you that AHPs are going to use it. So we have AHPs, nurses, and our clinicians using that across all different kind of specialties out in community and mental health as well. We have our was not brought predictor. So this is a predictive analytics model, and basically it uses the data to identify children and young people who might be at risk of was not brought. In paediatrics, we use was not brought rather than DNA. But actually this then allows us to support the families that are kind of coming up as potential risks for that. And then we contact them, try and encourage them, see if we can support them to attend appointments. And that's shown a positive impact on our was not brought rates for those patients as well. We have our ED predictor, and this is around kind of forecasting the capacity of our ED department. So it allows us to utilize those analytics and then see, okay, it's looking like it's maybe at risk, the capacity is getting a bit higher, and then we can look at staffing and use that kind of to support us in a predictive manner. And then etiometry. So this is aggregating our ICU data so that we can use this for real-time risk analysis. So obviously within an ICU, there are lots and lots of different data sources. And you get very live data that's going all the time, and this allows us to visualize that data and use that to support some clinical risk decisions. It's only being used as a support tool, so it's alongside that clinical decision making, but it's just presenting the data in a way that allows for kind of faster aggregation of that data. Then we've got some pilot technologies. So we have looked at Copilot, as many places have. So how can we utilise this mainly for administrative tasks within the trust? So using it for minute notes, summarising actions, those kind of things. We also are looking at the opportunities within clinical coding automation. I think this is an area that we touched on in the last presentation. You know, it can be quite there's not a lot of resource in this area, so we're looking at how this technology can support us to engage with that. Looking at things like avatars, you know, how can they be used particularly with our children and young people? We're wondering, you know, would this be a way that to engage them in a different way as well? But we've obviously got to do that in a safe manner. Looking at my more administrative tasks, so things like rota management, how can we use AI to support this and kind of speed this up? Obviously, I touched on before the radiology kind of AI projects, and then agentic AI for clinical flows. But I think one of the areas I talked around is how can we maybe improve processes and improve pathways? So this is kind of, we're just exploring how those technologies may support those pathways. But what we wanted to do is really engage with our patients and families and actually find out what they thought about AI. We didn't just want it to be, okay, yeah, NHS England is advising it, everyone's kind of moving in that direction, but what do our families think about it? So we did a quality round and we got 72 responses from a mixture of children and young people and parents. 92% of patients felt comfortable with AI being used. I want to caveat this, we are a children paediatric trust, so obviously we do have a younger generation, and whether that kind of sways the opinions of it and the understanding. But they were quite keen on the fact that they wanted a human in the loop. I think we hear that term a lot in AI, and actually for them, they wanted the humans kind of checking. One of the young people said they want the humans checking what the robots are doing. So, you know, kind of making sure that we're aware of what's happening and understanding that. They did have concerns about data security and privacy. I think young people are probably even more aware of this and kind of cyber attacks and those kind of things. So they were, you know, they were concerned about that. And I think we've got to challenge ourselves to be able to answer those questions. We've put out guidance around our AVT and the deployment to let clinicians know how the data stores, what we're using it, how we're using it to build the model, all of those questions, so that if we get asked, you know, our clinicians feel empowered to give those answers as well. They felt, you know, they want the technology to be used to increase efficiency. I mean, obviously they didn't say increase efficiency, they said decrease waiting times. But you know, that from our perspective, that was, they wanted to not be waiting as long. And they wanted to have clinicians focusing more on patients. I think one of the things that has come up, particularly from AVT, is actually our children and young people noticing that our clinicians aren't looking at the computer as much and are engaging in that manner. But I think, you know, all of those technologies, as we think about them, we need to think about, right, okay, does this help our clinicians to focus on the patients? And actually, if it distracts from it, should we in fact be looking at that technology? So it's just probably a challenge there as we go. And then transparency, you know, they said they wanted to know about it basically, and they were quite open that they wanted to know that it was being used. And then lessons learned from deploying AI. So I think obviously considering your benefits, you know, it is a project at the end of the day. So we want to think about those benefits. I think staff well-being for me is really major, but I think it can often get kind of put to the side a little bit. I think in the current system that we're in with cuts and money and all of that, you know, everyone's after what efficiencies can be made, how you can see more patients. But actually, the way you can see more patients is by considering your staff well-being and ensuring that they can remain in their job and do the best in the working hours that they're there for. So I think we really need to kind of measure that pre and post all of these technologies, and also understand that, you know, you can't do too many things at once. You know, you don't want to become, you know, doing two clinicians rather than working with them. And so you need to be mindful of how many of these technologies you try in at one time as well. Pilot the technology safely but quickly and fail fast. I think, you know, I don't think we've got the time to drag out some of these technologies. Some of them you have a go and straight away you think, nope, I just don't think that's going to work for me. And I think that's okay. And I think in this developing field, you know, there might be a technology that you come back to in a year and actually go, you know what, actually, you know, once they've developed this and this would be interesting, but perhaps it's too new in the journey at the moment. Ensure all requirements are still adhered to. It's no different from any other project. You've got to do your DPIA, you've got to do your clinical safety, and then you've got to consider whether it's a medical device as well as you go. We've had a lot of conversations around what classifies as a medical device and all of that. And I think having that community of CXIOs and kind of going to them for advice around and having those discussions in clinical safety groups around, okay, how have you done it for this technology? You know, it is different. Does have new challenges, but at the end of the day, they still really run in a very similar way. Scale quickly. I think doing things across different specialties. I think there will be technologies that work very for one specific, but I think at the moment in the current climate that we're in, we need to see the benefit across a range of specialties as quickly as possible. And in order to do that, we need to try them in a range of specialties. So I think keeping things as broad as you can. Obviously, with certain technologies, they will be for that specialty. But even in that specialty, you know, look at your different ages. For pediatrics, you know, it's great if it works for a 12-year-old, but actually, you know, how does it work for a 3-year-old? So you need to kind of consider your age ranges, your races, your ethnicities, all of that, and make sure it's as varied as possible. And consider the kind of ethical considerations around the AI as well. And then finally, I just wanted to give you a bit of our children and young person's view. So there's just a little interview with some of our children and young people. I do apologise, the sound is quite quiet on this, so you might need to turn your own mics up, but I'll just let our children and young people talk for a bit.
Hi, I'm Eva and I'm part of the Alta Youth Forum.
I'm Daisy and I'm also a part of the Youth Forum.
Yeah, so I went on the wards round and I went from the clinical side of it, so I got to see like the Lyrebird in action, and it made me like get like a point of view from it, like how like the clinician was like more focused on like the patient, which gave them more of like an view of like what was wrong with them, as well as taking notes and not being focused like on the laptop and the computer of making notes.
When I was in the appointment, it felt like the doctor was speaking to me more, and they had more attention on what I was talking to, and they had more focus on what I needed and what the problem was.
Yeah, so I spoke to the clinician and she said that it makes them feel more like better about themselves, knowing that they can like put like their full focus and view on the patient, which gives them a better experience and themselves a better experience.
I think AI is very good for particular bits, but I think sometimes it can be scary with some of the stuff that it does come out with.
The scary side of it is more like it makes like does something correct.
Yeah, they did say that they do read over it before they send it out.
And I think that's just what's best though, because you want them to be like you want it to be like correct all the time. I feel like it's good that we've got like that transparency to like show like who we are and like what we can use to make like the hospital a better place. Like AI being involved in the hospital is going to be the best thing for the new 2030 vision, because that's just like what we want. We want to be more in the future for the hospital.
And thanks very much. That's everything from me.
Thank you. Just my voice is going. Thank you, Vicky. That's great and really so helpfully framed and so generous in terms of sharing the strategy, but then also in terms of the enablement. Actually, what did that look like? With some really practical stuff in there, and actually really sitting through all that, the importance in terms of how you've actually engaged in terms of young people and children and hearing their voices as well was so beautiful. And also the lessons learned and that consideration around introduction of AI absolutely increases efficiency and performance, etc. But actually people are part of this. What does that mean? And actually, how do you keep a close eye on that and be measuring that in terms of what the impacts are and be mindful of that as well in a really focused way? And that's the forefront in terms of the session today as well. So massive thank you there, Vicky. And that takes me in terms of the second case study, which Leon's going to be bringing to you today, and from a very different perspective in terms of local authority and Wigan Council. So Leon, you're already there up on the screen. So if I can hand over to you, that'd be fantastic. Thank you.
Great, thanks, Suzanne. Yeah, I'll just pull up the presentation 1 second. Has that come up for everybody? No, great. So just as Suzanne introduced and building on what Vicky just took us through, really, it was just to describe some of our AI transformation adoption in Wigan Council, how we've undertaken that change and what we've learned so far, recognising that we're still at the early stages of our journey in terms of AI and technology transformation. Just starting with some really relevant concepts, really. Wigan is an amazing place. But there are some deep inequalities in health and wealth across our borough, and in response we co-developed 2 really core missions that drive everything we do, really, and that's about creating fair opportunities for all, but also making our towns and neighbourhoods flourish and for those who live in them and work in them as well. But in response and to help us deliver against them missions and our duty to citizens, our council plan at the heart of it is a really explicit commitment to transform the way we work and operate through technology and AI. And as part of that, we've developed a really clear, strong narrative of how we'll use AI for good in support of those missions, really. And it's focused on them 3 things on the slide. It's about how we deliver data and insight to inform prevention, service delivery in neighbourhoods. It's about how we really focus resources on things that make the biggest difference to our residents and communities. And then just as a council and recognising our anchor role in the place, really, it's also about recognising the potential of AI and technology transformation to drive new job opportunities and build economic growth and community wealth in the place as well. If we're going to maximise AI's potential and really deliver on their missions in the way we've set out, then we recognise that as a local authority, we can't do that alone. So we're developing this, but we need to do this with partners as well. So we're developing a digital ecosystem, if you like. So we're doing that work in partnership with local tech providers, with local businesses, with local education providers, and then developing our work with NHS partners in the place as well. We also recognise that we needed to start well. We needed a use case that showed real impact for our workforce and the people we care and support for in our place. So we started with adult social care, and we did that for some real conscious reasons. And the first one is that adult social care is really typical of the challenges that face us in the public sector, isn't it? And recognising that AI and technology can really help us with that challenge. And that challenge is rising demand against a real backdrop of limited funding and workforce pressures. But it's also about scale. So for any unitary council, adult social care is the biggest spender of the money as well. It's really high in volume. So in Wigan alone, last year, we had 26,000 people contact our adult social care front door team. We did 7,000 social work assessments, and we had over 1,000 meetings that needed to be formally minuted, such as safeguarding as well. So just in terms of scale and potential and recognising that challenge, we know that AI and technology can make a real difference. Also, this won't be unique to Wigan, but we've got a real strong foundation of confidence, not in AI, but in technology across adult social care, actually, because we've got a strong history of using technology for good in terms of reforming our menu of how we care and support for people. So whether that be introducing virtual home care visits, whether that be using virtual reality for reminiscence and people with dementia, whether it be using remote and sensor technology for people with learning disability, or even we've got a technology bungalow experience for staff that is even about creative application of consumer technology like an Alexa and smart technology, and the difference that can make to people's resilience at home in terms of frailty and sensory needs as well. So we had a real foundation confidence in adult social care around technology and the positive difference it can make to people's lives that we wanted to build on. I think we also recognised that a culture for innovation, if we were going to do this well and at scale, was going to be really important as well. And that appetite for positive risk taking. And in Wigan, we have 4 real core values and behaviours that really underpin the way we work every day and everything we do. And one of them is about being courageous. There's almost an explicit expectation with our staff, really, that we're open to doing things differently. And particularly in a local government context, we're lucky in Wigan and we've got really strong political sponsorship and support as well in terms of opportunities to trial, a bit like Vicky set out, and trial and learn from AI and the positive difference it can make, recognising that we won't always get it right, but we can learn quick at least. So we've got them foundations in place, which has really helped us. Just in terms of, again, like Vicky set out, really, the importance of involving staff from the start, not only because they're the experts in terms of understanding the problems, the challenges and where AI can help, but just in terms of staff confidence and engagement as well, really. So we started with a series of what we called innovation labs, and it was effectively bringing our frontline workforce in the room with digital capability and expertise as well, just to really work out where AI could make a biggest difference for us, mindful of the missions we've all committed to. And we got them ideas, and then we had a real process of prioritization as well. So we didn't want to even try a use case unless it delivered, we were confident it could deliver for residents, for staff and for finances. It had to do all 3. So that's where we generated the ideas. Out of them ideas, we've worked with a technology partner to develop a suite of products that came through those innovation labs. So just talking really quickly through some of the examples we've adopted to date, and one of them is our adult social care virtual assistant, so a chatbot. So our team in the adult social care front door, who received those 20,000 odd contacts each year, were telling us that they were a bit disappointed in the sense that residents who needed help and support and who rang us up, they were waiting 8 minutes. But we recognise we don't have the resource to keep investing in even more staff, so we needed to complement our amazing team with another part of the offer, and that's where the chatbot came into it as well. And we've carefully co-developed that with residents and people with lived experience as well, but it's helping make a real difference. It's available 24 hours a day, and it can also communicate in any language as well. But our staff were telling us that there were too many people ringing up just because they couldn't find the advice and information they needed in a way that they understood. And AI is really helping us make a difference through the chatbot on that. Those 1,000 meetings, as said before, and safeguarding meetings, again, staff telling us spending too much time on things that aren't the most important things to our residents and communities as well. So we developed a note taker tool. So it's a specific minute taking tool that produces specific outputs such as safeguarding as well, which is helping make a real difference for us. Resident insight and informing kind of service improvement plans. We've used an AI in terms of survey and sentiment analysis. Again, I referenced before the real financial inequalities in the Wigan Borough as well. And so we've used AI and data and insight to identify where residents might not be maximising available income or benefit support as well. So that's helping make a real difference. Another tool we've developed as well, it's effectively a speech to text solution. We call it conversation to assessment, but it's been designed with and for adult social care specifically in mind. But our social work staff were telling us that they're spending too much time at the commuter typing up conversations into a really complex assessment document. And when we looked into that, staff are spending about 1 to 2 hours per assessment on the computer and not in people's homes doing the things that make the biggest difference. So we developed this solution in response to that as well, and it's helped to make a real difference. We've rolled it out across 200 frontline social work staff now. About 400 assessments a month are being done using this solution, and there were some quotes there from staff who were just telling us about the real difference it's making to them. And that middle one's really important on the right hand side, isn't it? A social worker saying that it's helping me be a social worker again, and it's saving time so that I can focus on what matters. And then the AI tool means I can spend less time at the computer, more time interacting with people, which is the best and most important part of the job. So that's one example where it's making a real difference for good. The other one is, I just wanted to kind of reference, is we've developed an AI-powered case auditing tool. So it's a real example again of where AI can support workforce development, really. So in Wigan, we've developed an asset-based formula for a way of working, which we think is really important, and that's about staff having knowledge of the community and their neighbourhood and their patch, and having a different type of conversation that focuses on people's passions and interests, and then can connect people to their community rather than depend on a traditional menu of support. And what happens now is that for every assessment or support plan, the advanced practitioner can effectively produce a report using the AI case auditing tool in less than 30 seconds, and it gives some real positive feedback around the application of that asset-based way of working with the individual, but also some recommendations for what we could have done differently. And then we're just about to launch our strategic workforce assurance and development tool, which looks at all those individual audits and pulls out real themes just to inform our help and our training and development offer for staff as well, recognising the importance of that formula. Just the things that came out of the innovation labs that we're yet to adopt, but we are in the process of developing and have future plans for as well. And again, it's lots of the stuff that Vicky referenced to, but transition. So planning and preparing for young people with complex disabilities, currently supported by Children's Services, whose offer is going to look fundamentally different in adulthood. So we're using AI to help us model and predict what that demand might be, including identifying the need for specialist housing accommodation, so we can invest and build that accommodation in good time. Another one is falls prevention as well. So falls is the single biggest reason why people turn up at our local A&E in Wigan. But a lot of our falls pathway work, it's really good, but you almost have to fall, to be honest, sometimes. So we're kind of using AI to try and help us with some of our early intervention targeted work as well. EHCP work in children's, we want to build on the learning in adult social care to roll it out across children's social care as well. Radically reforming our customer transformation experience across the organisation, not just in adult social care as well. And then even things like freedom of information requests, that's really important duty for us as public servants, isn't it? But recognising that it takes up a lot of staff time actually, and with an AI solution, we could again focus our amazing staff and resource on the things that people tell us are most important to them in our support offer to residents and communities. Just again, we've developed this as we've gone, really, but we've got now a really established effective governance that is about safe, ethical, accelerated AI development and helping us find those safe solutions, but in a way that doesn't build bureaucracy, but allows us to do it safely. So we've got an overarching digital board which helps us oversee the work and make sure we're prioritising the right things. But we do now have a Gen AI policy and AI governance group as well, and they've helped establish and then oversee those AI responsibility principles, which are on the right hand side as well, which is always putting people, whether that be workforce or citizens, at the heart. We do have a robust approach to cybersecurity as well. So we have something that we call a joint architecture group, which is making sure that everything we do really has safety at its heart, but is solution focused, which is really important. And then we've naturally took a really important program management approach and capacity to help delivery and to do this well as well at the scale we want for the impact we want. Just conscious of time, I won't spend lots of time on this one, but recognising again that in technology and AI adoption, digital inclusion is really important. We recognise the importance of supporting people potentially excluded when around a radically different approach to AI transformation. And so AI solutions such as the virtual assistant, like I referenced before, has been co-produced with people with lived experience, and it's only part of our menu. It's to kind of empower and enhance our workforce, not replace people. And that's a really important principle that sits at the heart of our AI governance and ambitions as well. And then we've got things like TechMates, which is a volunteer network linked to that ecosystem I described before, which is people helping work with people in the community just to build some confidence around technology, and again AI as a power for good as well. Just whilst we've done lots of work, I'm really proud of our journey so far. So we recognise it's in its infancy and there's more we can do. So even in areas like adult social care, we recently did a staff survey. It covered the technology more broadly, but we had a really specific element on AI as well, testing kind of staff perception of AI, it's people's trust and confidence in it, its power for good and its opportunity to improve resident lives and outcomes as well. And it was really interesting to us in that or even if obvious, that where we had engaged staff and people had began helping shape and develop AI tools, there was a real high confidence. But even in areas of adult social care where we hadn't done it yet, actually there was still some real fear around AI and uncertainty about its use and its security and its ethics. So we know we've got more to do as well to get that consistent confidence across our workforce, across the organisation. And as part of that, we've again, Vicky mentioned some of these in Holder Hay when we're doing similar. We've got lunch and learn type drop-in sessions for staff that we're continuing to roll out, and we're going to begin really targeting that for specific roles within the organisation as well. We've recently launched our AI Academy, and we're starting with 30 level 4 AI apprenticeships, but it's apprenticeships in existing roles across the organisation. So again, there are 6 people who are in different roles across adult social care, but really important in them helping understand adult social, the power of AI in areas like adult social care, and then be able to empower that confidence across peers and other parts of the workforce as well. But if we're going to maximise AI and technology for the good of the place in terms of new employment and economic opportunities for local people, then we know we need to develop that AI Academy concept out. So we're just drawing up plans at the moment, which is really exciting, working with our local university and college, our NHS partners and local businesses as well. So just to summarise our learning so far, and again, some of it Vicky referenced and some of it I'm sure will be covered later on in the agenda, and I know some of this is pretty obvious, so I won't go through all 12, but that first one for us is really important. Just recognise that AI actually pointed in the right areas and done the right way can really empower, not threaten the workforce. The importance of prioritisation as well, recognising, said for Wigan, those 3 things are really important. We won't do an AI development unless we think it can benefit workforce experience, resident and citizen outcomes, and our finances as well. And important not to fall into the everywhere but nowhere trap. We've been really conscious of that in Wigan. And then the last one is in our workforce engagement, where what we learn really quickly, even if obvious, is that we need to be really mindful of language. So absolute need for transparency in the technology that we're using, but staff care more about the solution and the difference it can make to our residents than the technology itself. But we can sometimes be a little bit guilty of using unnecessary jargon, I think, and generative AI chatbots kind of like it just sometimes can create unnecessary anxiety, like I said, and said staff care more about the solution and technology. And I think in any staff engagement work, that's really important to bear in mind. Just say thank you for listening, really. Again, I know Suzanne mentioned the slides will be shared later, but if anybody does want to get in touch just to learn a little bit more about some of the work we're doing in Wigan and some of the products, then absolutely people are free to give us an email on that address on the slide there. Thank you.
Leon, thank you so much. Really powerful, another really great powerful story of transformation, really grounded through place and people, and great in terms of hearing in terms of the positive impacts, particularly in terms of that conversation to assessment, and social workers saying in terms of the enablement that it's enabled me to do the job that I love doing, but also in terms of sharing how you the practical measurement as well through the staff survey as well. Really, really powerful stuff. There are also, I can see a flurry of questions in the chat box, Leon, as well. So you've obviously generated quite a lot of interest there, to say the least. So if it's all right when you get an opportunity to have a look at those questions, that'd be fantastic. And then really leaning into that people element and the well-being in terms of actually practically what does this all look like in terms of how you manage this change, transformation, what does that really mean? So at that point, I'm going to come to Joe that's going to navigate us through that section. Thank you, Joe.
That's great, thank you. And thank you for giving us some fantastic insights into those great case studies. Those are really fantastic examples of not just how you've delivered change, but how you've engaged people in that delivery as well in a positive way. One of the biggest issues that we have with change and technology is at the heart of it, what we have is people. It's people that need to change, and that can be the trickiest bit to try and manage. The bit I'm going to share with you now is how do we think about that people side of it when we're looking at using AI technology to improve the services that we offer, but also how can we use AI to help us manage and plan that change with people effectively, so it can be used by us to help us plan those people changes. So I'm going to talk a little bit about neuroscience and how that relates to effective change management. So we're starting into really a new age where we're moving beyond the sort of mechanistic processes around change management and really looking at combining it with the tools from AI and technology to support that change delivery. So it's really looking at sort of neurointelligent change planning. How can we use these insights to help us deliver more effectively, get better outcomes, greater adoption, better confidence? And these are some of the things that we're going to look at. So being able to combine the use of AI to help you deliver that people change with some neuroscience insights to help you on the way. I've got a couple of questions for you. So if you can scan the QR code, I've just dropped the link to the Menti in the chat. So if you can do that as quick as you can, that would be fantastic. And we'll get to the first question. How does change at work make you feel? Let's have a look at what people are saying.
In the chat, please.
So we've got some people who are really excited by it, and I'm not surprised by this audience, to be honest, because this is a self-selecting group that are quite excited and interested in this. But even so, if you think about how you respond to change, and maybe not the things that you're excited by, but actually other people are imposing change on you within your organization, what does that feel like? So we've got some interesting words here. So we're anxious, apprehensive, nervous, positive and optimistic. So we've got some good stuff, uncertain. So this is a really interesting mix. And even though you might be a group of people who are at the front end of some of this transformational change, it's still sometimes an uncomfortable journey to go through. And what I want you to have a think about is, what are the elements of it that make it either positive or negative? Because if you think about what are the things that make it negative for you, what would you like to have in place that would make it better? What would make change at work feel more positive? Why? Yes, absolutely. Clarity. Why are we doing this? Feeling listened to, that you are a part of the conversation. Being included, effective communication from the start, clear structures and purpose, a way of structuring it, honest communication, completely transparent communication, forums to ask questions, that ability to query and to challenge, time to process it. Absolutely. Do we give everybody the time to be able to process the change and get involved with it? Enough time to learn and adopt. We're going to be covering why some of these things are important from a neuroscience perspective and what you can do to help to plan them in more effectively. Be part of the conversation, collaboration, strong leadership, co-design, involvement in the process. Absolutely. Training, protected time for understanding and participation. Being able to see the aims and objectives and how it will make a difference. What's clarifying what's behind the change. Yeah, absolutely. These are all fantastic things that we would all want to see if there was change going on that affected us. So when we think about the changes that we are leading, are we doing all of these things for the people that we're engaging in the change? Are we making this the environment that we would want to see? And are there any suggestions from here that we can take away to say, well, actually, maybe I'm not doing so much of this bit or that bit. Have I got enough time for training? Am I giving them the space to get involved? Because you've effectively given me all the answers in terms of what are the things that we need to put in place to support change to happen. it might be useful to turn this into a bit of a checklist to say, how am I doing against these things? Is there something I could do to improve it? Fantastic, thank you. I'm going to move on now because we've got quite a bit to get through. So just thinking then about change and some of the responses to change, and we've got some fantastic individual examples here, but there are also some, systemic changes that aren't always landing especially well. And KPMG, who have been doing a report on EPR productivity, have picked out some specific things around the people side of the changes and where there could be potential improvements around that. So one of the report's qualitative findings was that change management was an important determinant to deployment outcomes. So how much of the time is spent on change management? Strong change management will allow users to adapt quickly and to the platform and will help them embrace the opportunities that EPRs present. If the change is not made understandable and real to stakeholders, stabilization and optimization will take longer and productivity benefits will be delayed. So coming back to your point about why are we doing this? What's it for? Have I got the time to get involved? Am I being involved in it? These are all kind of really useful insights. It's not in the original slides because this only came to me yesterday and I thought I'd give you a quick view. It's not actually published yet, so I can't give you the link, but these are some insights that are useful to take away. I've just highlighted, I know there's a lot of text on here, but this is part of the report. I've just highlighted the elements that lead into that change management bit and why they're important. Leadership needs to own the change. Visible clinical, operational and executive leadership was essential to legitimize change, sustain momentum and challenge legacy practices. Change management teams often did not have sufficient experience. Do we have enough people with change management capability and enough support to develop them into experienced professionals? Organizations did not understand the opportunity for change. Now, this is an interesting one. Some trusts prioritized business continuity and safe go live, which you kind of expect is normal, over process redesign and optimization for what their EPR could help them do. So they got the EPR system to do what they were doing currently. They didn't use it as an opportunity to revolutionize what they're doing and look at how we could actually do these things better and more effectively. So there's a bit of a missed opportunity there. Organizations did not understand, EPR programs were seen as digital programs. Does everybody agree with that? EPR programs are digital programs? What they're saying is non-digital teams viewed the EPR programs as something being delivered by the digital department. Organizations were not owning the change activity. But actually, the vast majority of what the program needs to do is operational and organizational change, and people and cultural change. And maybe the digital team could have some help with that from other parts of the organizations. It needs to be a bit broader. Just two other things. Support visible leadership and whole organization approach. So what does it mean in terms of NHS England support for things like EPR programs? EPR programs should be treated as changes that affect the whole organization, that it's not just a digital product to be rolled out. And NHS England should support trusts to build change management teams with experienced practitioners and appropriately resourced. Those are the kind of basics that we would need to have better implementation and engagement. Now, if any of you are familiar with the work of Julie Atkins at NHS England, who does the change transformation work, she has the Change Onion. And I just want you to have a quick think about where the people side of the change comes in. When we look at implementation, we really focus usually on the product. What's the system? What's the IT? What's the AI that we're implementing? And, is it working? Is it doing what we expected it to do? Is it functional? So that's the product. But if we don't build the change of business processes around it, how are people using it? How do they interact with it? How do they use it in the real world? Are we working differently in order to get the value from it? Have we put enough time and effort into redesigning those business processes? And then the change management bit is taking people on the journey with us, including them from the start, as you said, that you'd like to see, engaging them, but also then ensuring that we put enough time and effort into the capability development and the adoption. And only when we've done that will we actually deliver transformation. Without the adoption, we don't have the value from it. We've got a product, we might have some processes, but the value that we're looking for isn't achieved until we take people on that journey with us. So for those that might not have come from a background that looks at change management, just a quick introduction. What is change management? And this comes from the Change Management Institute. Change management represents a domain of principles and practices that enable stakeholders of change to adopt the mindsets, behaviours, and capabilities required for that change to deliver full business value. And that comes to my last point. You don't get the value of that product until you've got the mindset, behaviours, and capabilities in place to use it effectively. But we have a lot of barriers to business transformation success, and statistically, over time, they still haven't improved. So what do we need to do differently? So I'd like you in the chat to say, how many of these top 10 barriers to successful business transformation do you recognise? Out of 10, please, in the chat. 10. Yes, thank you, Paul. Yes. Who else? Resistance to change. Yes, absolutely, is a big one. All of them. 10, 10. 8, 6. And I think there's also something we could do in terms of, even if they're not all fairly disastrous, there are tweaks that we could do to improve them. Unrealistic expectations, yes, coming in third. So we've got a fair consensus that actually these are pretty much a bit of an ongoing problem. Now, bearing in mind, this research was done by IBM in 2010, 16 years ago, and 16 years later, we're looking at these things going, yep, there's still a problem. So what do we need to do? What's the insight here? And what we need to look at is, what's the difference between what might be a project problem, what might be a change problem? Now, these 5 directly relate to the people side, the change management and stakeholder engagement bits. And you'll notice that's the top 3. The top 3 are all people related. And these relate to the things you were saying in the Menti as well. So resistance to change, inadequate sponsorship, clarity of who's owning it, but also unrealistic expectations. Yes, and Lawrence put a good comment in, lack of skills and not recognising training needs. Absolutely. So what can we do about it? How can we use the new technology to help us to improve how we do people change? So I want you to have a think about, we're going to look at neuroscience and what it tells us. So the objects of our change are people. We want them to change their mindsets, their behaviours, and their capabilities. But the brain is threat sensitive. It is on the lookout for threats all of the time, and it will trigger a response in reaction to those threats. And anything that changes our comfort zone, our routine, the way we do things, our sense of autonomy, how we operate, can be perceived as a threat. And that'll be triggering. So it triggers the amygdala, the part of the brain that is therefore fight, flight, or freeze, to respond to it. And what happens is that learning sticks when we have an emotional, social, and repetitive and safe environment. So if we're presenting people with a change that seems threatening, it's going to be fearful. They're going to fight you on it. They're going to avoid you to get away from it, or they're going to ignore you because they're freezing and they don't know quite how to cope with it. So how do we create a positive environment that is less fearful, reducing the fear of that change, and creating an environment that allows that engagement, that repetitive activity to build new neural pathways and make it safe? So AI doesn't replace human change. It amplifies it. We're not getting AI to do this for us. What we're doing is we're using that to support us to do the ultimate human engagement activities. So what we're doing is combining neuroscience insights. AI becomes a very powerful engine for safer, faster, and more sustainable change. And we're going to look at how we can use some of that. I just want to take you briefly to what journey we go on when we're presented with change. Now, this is the Kubler-Ross change curve. Some of you may be familiar with that if you're working in clinical services, where you've got it was originally designed around coping with grief and the grief stages that people go through. Change management looks at it and looks at change as a similar experience, because when we are expected to change what we do, who we do it with, how we do it, there is a loss associated with that. There's a loss of comfort, there's a loss of familiarity, there's a loss of community potentially, there's a loss of status and autonomy. So when we're presenting people with change, this is the kind of journey that we need people to go on. Now, if you're excited by change and it's not negatively impacting you, you're going to be straight across that bridge going, woohoo, let's go. But for some people, the threat of that change can really destabilize them. So what we want to do as the people who are leading and delivering the change is we need to create a bridge for people. How do we reduce the pain of that change, and how do we lead them across that safely? Because what we don't want to do is we don't want people getting into the state of anger and depression and despair where they feel like they're in a churn and they can't get out of it. How many people go off sick when new systems come along, that they feel overwhelmed by change? Actually, we have the power to de-fear it and to provide stepping stones to get people across safely. I just wanted to bring that to you as a sort of visual before we go into the bit about neuroscience. So neuroscience is all about what happens to us when we're presented with change. And I'm just going to look at two of these three elements. So neuroplasticity. Neuroplasticity is about the structures in the brain and pathways and connections and building new pathways. Have we all heard the phrase, you can't teach an old dog new tricks? Yep. Well, the evidence is in. It turns out you can. They just have to be sufficiently motivated. So give them enough treats and they will learn. So part of it's about how do we support people to build new neural pathways. The next bit is about brain chemistry. The emotions that are created that we have that are fired up by chemicals created in the brain in response to threats or positive things. And then brain waves, and this is the state in which the brain is being enacted. We don't have time to cover that one today, unfortunately, but it's important that we create an environment for change that allows people to respond to it in a positive way. So taking them away from the stress and the hassle of the day-to-day operational, and a quiet space where they can think cognitively and get into a different brain state. So what happens when we're presented with something that's a threat? I already mentioned that the amygdala is triggered, but what happens when the amygdala is triggered by something that appears to be threatening is that it blocks off the prefrontal cortex. So you stop thinking. Now, if you're scared and running for your life, that's great, because you don't want to be stopping and thinking about all the options here. You just want to run. So it's designed as a safety feature, you know, to protect you. It's for survival. But the problem is the brain can't tell the difference between fantasy reality, and it can't tell the difference between a physical threat and a psychological threat. How many people, stick your electronic hand up if you don't like horror movies? There's quite a few of us there. Stick in the chat why you don't like horror movies. So while you're doing that, the thing about being in a survival mode, that fight or flight, that fear response, is that it's basically generating emotions around fear, anger, disgust, shame, sadness, and attack. It's all negative emotions. Now, it's that survival instinct, and we are programmed to respond to a fear threat with those emotions. So people have put, I usually end up thinking about it nonstop. Emma, absolutely. Your brain is triggering and going, okay, there's a threat out there. Right, we need to be on alert for it. If we're alert for it all the time, we get a constant state of stress on our bodies because we're constantly worried about what's coming next. And therefore, we get real stress and cortisol anxiety. So it's an important thing that we allow people to relax from change and stop it, because if it's a constant thing, then they're going to be in this constant heightened state. I like to sleep at night. Yes, the jump scares. Yeah, And again, it's that tension. Your body is ready to respond to it. But how many of those actual things are in real life? You're sitting in the comfort of your living room with a cup of tea or a beer or some snacks, imminent peril and the zombies aren't actually going to get you, but your brain can't tell the difference. And it's the same between a physical attack in terms of, you're out on the street, you're worried for your safety, and a psychological attack, which is actually, how is this going to impact on me? What happens with this change? Am I going to lose my job? How many people, when they're presented with, oh, AI is going to solve all our problems, it's going to make everything so much more efficient, how many people go, am I going to lose my job? Is what I do not useful anymore? How do I pay my mortgage? How do I feed the kids? And suddenly you're in this sense of anxiety and your brain is offline. So what we need to do is we need to get people into a state where we don't trigger that fear response and that we can engage with them in a cognitive way to get them curious and creative and excited and enthusiastic about it. Some of the things that you guys were in at the start in terms of change, you go, yeah, this is great. So we need to curate that environment that will allow that to happen. So quickly, I want to just get your thoughts on this. In the Menti, back in if you can. Hopefully you've still got it open. So in response, let me drag it across so it's there on the screen if you want to scan it again. In response to your organization's change programs, where are most of your people operating? Are they online? Woo! Are they offline? Woo! Are they somewhere in between? Some are here, some are there, that we're struggling with some. And, if anybody's not quite sure. So we've got quite a lot we've got a mix of the two that, some are online, some are offline. It's a mix. We've got more kind of offline. We've got a few online that go, yes, we're up for this. But it's not everybody. And part of our problem is what happens if we don't take everybody with us on this journey? What's the impact? My best friend was a medical secretary for a trust in the gynecology service. And she'd gone semi-retired down to 2 days a week, and she had cancer experience. And so she was off for a while. And while she was off, they brought in the new EPR system. And after 30 years of kind of working in this space, suddenly she comes back and she only works Monday and Tuesday. And there's this whole new system, new ways of doing things. The training was on a day when she was off. She came in after being off for 5 days and not really understanding what was going on. And it shattered her confidence in her ability to do her own job. Suddenly she didn't feel confident to do the job that she'd been doing for 30 years. And so I think like a lot of people in that situation that kind of can do go, okay, well, I'm going to leave. And she left. And now works for a supermarket, which is a lot less stressful. But what's the consequential cost of not taking people with us? The cost of resource, the cost of capacity, the cost of capability, the experience that we have in these people that have invested decades in their knowledge and experience. So what do we do to address that balance and get more people online, able to engage with us effectively? So I'm just going to quickly go through this, but we want to change the dynamic from generating fear and a fear response to how do we create a positive response? How many people are scared of cake? Anybody scared of cake? No, nobody's scared of cake. Cake is nice. Cake is good. Cake makes us feel good. Even if you're diabetic, you can have diabetic cake. It's good. You're scared of your mother's baking. But the point about this is, how do you create a positive brain environment where people have positive associations with the change that you're trying to make? So how do we create that brain-friendly space? So energy-saving consumption. This is an important part of it. If people are too busy, they're overwhelmed, they're overloaded, they are not going to have the capacity to engage in your change. You need to create the space for that change. The brain uses 20% of the body's energy. If you're asking them to learn how to do something new and do something differently, you're going to have to get some capacity for them to use some of that energy to engage in your change. The second bit is pattern recognition and familiarity. Do they understand what you're trying to do? Is it familiar? Is it relatable? Can they see what you're trying to achieve? I remember 2005-06, I remember seeing adverts for a new product, and it kept saying things that I didn't understand. I had no frame of reference for it. I didn't get it. And it kept saying, there's an app for that. There's an app for that. Yeah, what's an app? What? Does everybody remember those adverts? What was it for? First one in the chat. What was it selling? There's an app for that. The iPhone. Thank you, Ross. Absolutely. At the time, I had a Nokia 3310. Who else had a Nokia 3310 in the past? Stick your hands up. Come on. Confess to it. We know you had them. And they were awesome. A, they were indestructible, which the iPhone certainly aren't. But also, how much fun did we have? I mean, you know, it took phone calls. You text messaging, as long as you remember to press the button enough times to get the right letter. And we played the snake. Thank you, Paul. Snake. Exactly. It was awesome. It did everything we could possibly need it to do. And then suddenly came along these iPhones, and it did something transformationally different, completely different, that we had no way of understanding. I had to go out and buy one because I was scared I was going to get left behind by this technology I didn't understand. But not everybody's going to do that. So how do we de-fear it for them? How do we make it relatable? This change, it's not different from what you normally do. Here's how we can make it similar to what you already have in your life and the way you already work. Make it relatable. And the last bit is hunting and laughing. And this is about creating positive chemistry. Who likes to do puzzles? Sudoku, Wordle, pub quiz. Who likes a good pub quiz? We like a good challenge. We like to get that sense of satisfaction of having completed it. Generally, there's no prize at the end of it. You don't get a reward. There's no big, payout. It's a sense of satisfaction. What that is, that's dopamine. That's making us feel like we've achieved something. It's important that you do that with people. The comments earlier about you want to be involved, you want to be participating, you want them to create that sense of dopamine, that sense of reward by coming up with the solution themselves. How's it going to work? How's it going to work in our department or in our team? That sense of dopamine will not just give them a sense of reward, it will also engage them in the change that you're working on. And the laughing bit is endorphins and oxytocin, and it's that feel-good chemicals that make you feel like you belong. It's about participation. It's about being part of the tribe, being part of the team. If you exclude people from this change and you do it to them and not with them, they will feel like they are not a part of it. They're excluded, and you're not going to get that positive chemical feeling. That's the stuff that makes people feel part of that group. So how can you create that and create those positive associations for them with the change? So what can AI do to help us with that brain-friendly change? AI and good leadership together can reduce uncertainty. Personalized support. We've got the technology to use it to frame, how do I help this group of people? How do I get them involved in this? How do I track how people